Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, October 12th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Mikowski, Student Research Assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Good morning, Sophie. Thank you.
In the United States, yesterday, we saw 50,000 positive new cases with our 7-day average just below 40,000 positive new cases every single day. The United States is seeing a 24% decrease over the last 7 days, with the booster shot uptake being at about 33% in the United States. Hospitalizations have decreased by 8%, and the death rate has decreased by 3%. In Illinois, yesterday, we saw a pretty massive spike with over 4,400 new cases. The case positivity rate weekly is around 1,500. There's been a 34% decrease in the last 14 days, so who knows what happened yesterday. And hospitalizations have decreased by 13% in Illinois, with the death rate also decreasing by 3%. Okay, I know we're going to get into this a little later, Dr. Murphy, about like these statistics and vaccinations, but like, what is going on with these numbers in comparison to last year, in comparison to the surge that we're supposed to see soon? The numbers look great.
Well, these things are never simple. There's no one thing that is driving this whole pandemic at this particular point. The good news is that the overall numbers are down. Now, the increase you mentioned in Illinois is, I think, partially due, if not completely due, to the fact that the reporting is not as vigorous on a daily basis. And many places have gone to reporting just weekly. So, it's cumbersome to report all this stuff on a day-to-day basis or whatever, and we're not in really an emergency situation anymore. So they'll keep reporting, but it's going to be more on a weekly basis. And that's fine. That's basically how we do flu reporting and other diseases. They don't get reported real time like COVID was. So don't worry about any of those bumps. Just look at overall, what's happening, 7-day average, and look at what's happening in different regions of the country. So it's really good news that the cases have come down so much, but we still have too many deaths per day. And it's still way more than the flu on average. And there's still people in the hospital. And one little bit concerning thing is that they're having big upticks in Europe right now. And it's a mixture of BA4 and 5 with some other subvariants of that. They're having upticks in South Africa. And everyone is predicting this winter surge. It's a little bit like the weather. Hopefully, I don't know, hopefully they're wrong and that there isn't going to be a big surge. So what's protecting us now is that, a sizable portion of the population is vaccinated. A less than desirable amount is boosted. We have a new booster. The uptake is very low. And the new booster works against the newer variants, the Omicron variants that are out there now. So, that's going to help. The other thing that's helping is Paxlovid, the drug treatment, and there are some other treatments coming along. And you're going to see that it's this mixture of being vaccinated, being updated with your booster, having an actual antiviral treatment if you do get sick, and the fact that so many people have had COVID. That gives you some protection as well. So you put all that in the package, and you can look at the countries around the world, and you can do the modeling to predict when there's going to be and how big it is expected the next kind of wave. So if the wave may be starting in Europe, I don't know if you remember at the beginning, it started in Italy, of all places, and then other European countries followed, and then it happened in New York, and then the story is well known. So that's the global picture. it's not over. We shouldn't let our
Mhm.
guard down. And I think we're going to get into some of these other stories, and we can talk in more detail.
Yeah, absolutely. So a lot of what you discussed goes into our very first headline, which is that the White House is now saying that the risk of COVID is almost zero for people who are boosted and treated. What does this mean for the only 33% of the United States that is boosted?
Well, this should be a headline that's screaming, because we now have the data and we've got the tools to analyze it. And Dr. Jha, who's the big expert now with the US government, is giving us the information that the US government has collected. So he's reported recently, this is about 300 deaths per day. That's
Mhm.
3 times the flu rate, so let's keep that in mind. But the risk of dying from COVID, like people, it used to be so high, 70% of the people dying from the virus are 75 years and older, didn't have the
Mhm.
latest shots, and aren't getting the treatment with the drug called Paxlovid right now, even though they're totally eligible. I mean, it's given to people with any kind of underlying immunologic disease, or if you're 50 or older. And so the people that are dying are the ones that are not fully vaccinated and are not taking Paxlovid even when they do get sick. And so this level of death from this serious disease is way out of proportion to what it should be. And, this is very hard data here. And so it's critical that people, for this winter surge that may be happening in the next few weeks or months, to be protected, get that new vaccine. The vaccine is a bivalent vaccine, which means it's half of the old vaccine and half of the new vaccine, which is geared towards Omicron, which is the current variants that are circulating now. So if we do that, this thing won't go away. It's going to be like the flu, but it might not be as bad as the flu. Because this treatment is really potent. It's so much more potent than Tamiflu, which we use for the flu. I mean, the treatment is really incredible. So we've got to be on our guard. Don't let the guard down. Now, people are going back to work. I've noticed myself, I take the red line every day in Chicago, and it's like getting crowded again on the red line. And finding even a place to stand. I haven't had a seat for a couple of weeks. And then people back in the offices, and many offices requiring people to be back in at least a few days a week. All that stuff, we are mingling a lot more. The restaurants are open, kind of hit or miss as to who's wearing a mask and not. But if you want to be protected from getting seriously ill, get up on the vaccines and take treatment if you do get sick.
Wow. All righty. Well, our next big headline that goes, right into the headlines from before is that the COVID-19 boosters could prevent about 90,000 US deaths this winter, but only if people get vaccinated, analysis says. So 90,000 deaths for the
Yeah,
winter. What does this
yeah,
mean?
yeah. This is, people will die from this disease no matter what. But the estimates now, based on what we know, the efficacy for preventing severe disease with the vaccine and with the treatment, you can save approximately 90,000 people. Generally older and frail or having some underlying immune condition, but 90,000 people is a lot of people. And if we don't catch up with that, if there's another wave, that 300 deaths per day could easily jump back up to 1,000. So we have to be vigilant with this. It's just it's totally preventable. And the pandemic is not over. It's unfortunate that the terminology is so confusing. The emergency part, the life and death situation for anybody who got infected, that is over. We can manage this disease now and really cut the death rate and serious infection rate. That part's going quite well. but we got to do it. We have to implement it. We have to get people to do it. And I hope not only people who are watching this, I hope they keep up with their vaccines and take the treatment if they need it, but convince other people around them. There's like Dr. Jaha just said, most of those people, the 300 people a day that are dying, didn't even take the treatment that is available free as of this time. Now that they may have to start paying, or their insurance will pay at some particular point, but they're not even being offered it. I was having dinner with a person who had COVID 2 months ago in the age group that it is recommended. They said, "Oh no, I didn't take it because I'm otherwise feeling well." I said, "Well, you're otherwise feeling well, but like you still have a chance of getting in the hospital." Or having long COVID, it's like, that's just another whole story altogether. So, but anyway, the numbers, now we're learning more about it, and we can keep these numbers down if we protect ourselves.
Yeah. And then going into the last and final headline, people experience some key personality changes during the pandemic, a new study is finding. What can you tell us about this?
Yeah, the pandemic has been very stressful for everybody. I mean, look, the whole world really turned upside down over the last 3 years. And it's been incredibly stressful for kids, for adults, for people with underlying diseases or mental issues. It just doesn't make any difference. Everybody has been completely stressed out, and it's just not the way that it used to be. Even with the restaurants kind of full again, there was an article in the Tribune today about the restaurants are back and they're full, and which is great, and but people are not staying out late. They're the places that have these late liquor licenses, and people go after dinner for drinks or whatever like that. It's really pretty quiet out there. They're not going out like that. So it's changed the whole culture really in many ways, and it's presenting with many any kind of stressful situation can cause anxiety, depression, sleeplessness. It's really it's quite prevalent. And it's things that we can deal with, and we'll try to get back to some kind of normalcy. But, really until we get the immunity continue to be up and people accept the preventive approaches like vaccines and the treatment, I think there's still going to be this anxiety. And, the only thing we can do is just try to treat ourselves better.
Yeah, absolutely. And now going into our first COVID and only question. This individual says, I had COVID in late July, and I'm vaccinated and boosted with only one booster. My partner just tested positive, but I am still within 3 months. Do I need to isolate myself from them? Do I need to wear a mask? And am I likely to have immunity having had it less than 3 months ago?
Yeah. Now, remember, with the original vaccine, which is what this person had a couple months ago, they are not protected from infection. So they can get infected. They most likely will not have serious disease, which means hospitalization and potentially death. I'm assuming they're relatively young. This is such a common scenario, but because the vaccines are not protected, we don't know about the new one because that's being studied as we take it. But with the former vaccines, if you're not boosted with the new one, you're still at risk for getting COVID. I mean, you don't want to get COVID. What if you get long COVID? I mean, anybody of any age can get long COVID. That could be, chronic fatigue, headaches, aches, pains, all sorts of things. This person should isolate. The patient should isolate. The other person around that infected one should be wearing a mask if they have to get anywhere near that person until they get out of the quarantine. So the quarantine is, that hasn't really changed too much. It's 5 days from the date of the test, if there's no symptoms, or the date of the first symptoms. And then the second 5 days, they can get out more if they're feeling well and have no fever. But they have to be sort of careful out there for the second 5 days. So the whole thing kind of is over in 10 days. And we know after 10 days, if somebody has improved clinically, that they're probably not contagious anymore. And that's the whole name of the game. So the ringer in this whole thing is, what about doing tests to see if you're contagious or not? So the PCR test, which is the best test, is going to test for many weeks, even after you're completely non-contagious and you're back to work and whatever. So don't do a PCR or a molecular test for follow-up. You want to do that antigen test, the rapid one, the one you can purchase at the drugstore or get from someplace, and you want to test that. And what that will tell you is that if it's positive, you are potentially contagious even after 5 days or even longer. So that antigen test can tell you. Now, if it's negative, it doesn't predict as well, but at least it can tell you that, like, if you're at 5 days or 7 days and you do that test and it's still positive, you're most likely contagious. So it does give you some benefit. And of course, being negative is, of course, better than being positive, but you still follow that kind of 10-day rule. And this thing, that hasn't really changed. So that's basically how a person in this situation should deal with this.
Wonderful. Well, thank you, Dr. Murphy. And we will see you next Wednesday.
Thank you, Sophie. All right. See you next week.
Bye.
Bye-bye.